morning, ladies and gentlemen. The officers, leaders, honored guests, and members of the United States Army Medical Command Branch Services and friends of Munson Army Health Center would like to welcome you to the Munson Army Health Center Virtual Change of Command Ceremony, bidding farewell to the outgoing commander, Colonel Scott A. Mower, and welcoming the incoming Health Center commander, Colonel Garrick Cramer. Ladies and gentlemen, please rise for the rendering of honors, playing of the national anthem, and the invocation given by Chaplain McDonald.
Please pray with me. Almighty God, Lord of life, to whom we owe all things, bless us with your presence in this ceremony and grant us grateful hearts for lives of continued service to you and our nation. We especially give you thanks for your sustaining love and faithfulness to Colonel Scott Mower and his family as they provided care and leadership during this time, and their selfless service was reflected as they served Munson Army Health Clinic in Fort Leavenworth. Bless Scott with your wisdom, your strength, and your vision as he and his family transition into new chapters of service. Lord, we are in the midst of one of the most trying events of our lifetime, and in this time of crisis, we need great leadership. Thank you for blessing us with Scott's tireless devotion to safety and innovation in securing the health and welfare of our community. Lord, we also thank you for continuing to ensure our well-being through the installment of Colonel Garrick Cramer as the new commander of Munson Army Health Clinic. Bless Garrick and his family with every spiritual blessing necessary for the task you have set before them. Now to you, our great God and King, be all the glory, both now and forevermore. Amen.
Ladies and gentlemen, please be seated. Today's official party is the reviewing officer, Deputy Commander of Regional Health Command Central, Brigadier General Wendy L. Parter. Ma'am, we thank you for officiating today's ceremony. Biographies for today's official party can be found in today's program and on Facebook. Today we're joined by many distinguished guests, visitors, friends, and family of Munson Army Health Center, and among them are Command Sergeant Major Gabriel Camacho, the Command Sergeant Major of the Soldier Recovery Unit at Fort Sam Houston. At this time, on behalf of the soldiers and families of Munson Army Health Center, we'd like to recognize Mrs. Tara Mower with a gift that reflects the loving concern and support that she has shown for soldiers, their families, and civilian staff. We would also like to recognize Colonel Mower's mother, Mrs. Bonnie Mower, Uncle Louis Blenard, Aunts Paula, Leanne, and Donna Sue Blenard, and Colonel Mower's kids, Cadet Savannah Mower, Specialist Angie Mower, Specialist Kevin Mower, Specialist Nixon Mower, and Mr. Cole Mower for their continued support to Colonel Mower. And at this time, we would also like to thank Mrs. Michaela Cramer and daughter Angelica Cramer with a gift as a sign of welcome and in anticipation of things to come. We would also like to recognize Colonel Cramer's parents, Carl and Nettie Cramer, in-laws Giovanni and Marissa, and siblings, Carl and Natasha Cramer, for attending today's ceremony. Since the inception of Fort Leavenworth as Cantonment Leavenworth on May 8, 1827, there have been 5 hospitals located on the post. Each hospital has provided health services to the command and the military community for 193 years. The first hospital was built in 1827 on the southwest corner of Kearney and McClellan. It was one of the first 2 permanent buildings erected on Cantonment Leavenworth. The building was closed as a hospital when a new one was built in 1855. The second hospital on Fort Leavenworth was constructed a few yards south and east of the first hospital. Built in 1855, the hospital was located here until a third hospital was built. The third hospital was built in 1883 as a 40-bed hospital and served as the post hospital until 1902. It was named Dickinson Hall in honor of First Lieutenant Walter M. Dickinson, who died in 1898 from wounds received in action in Cuba. The building currently known as Dickinson Hall is now located on McClellan Avenue. The fourth hospital on Fort Leavenworth was built in 1902 and provided hospital services until 1961. In its time, it was one of the most modern, up-to-date hospitals in the United States. Initial capacity was 190 beds, and initial cost of the facility was $67,000, or 19,000 square feet. Several additions were completed throughout the years, bringing the hospital up to 32,000 square feet. This included a woman's wing added in 1910. The building is referred to as Building 198 and houses the Resiliency Center. This structure was memorialized in 2011 as Lowe Hall in honor of First Sergeant Percival G. Lowe. Construction of Fort Leavenworth's 5th hospital was completed in January 1961. The hospital was dedicated to Brigadier General Edward Lyman Munson on March 29, 1961. General Munson served in the United States Army with distinction from 1893 to 1932. He was associated with Fort Leavenworth as an instructor in the Army Service Schools, now known as the Command and General Staff College. The hospital underwent a $13 million modernization in 1985. The hospital was renamed Munson Army Health Center in 1997. Many military customs have their origins as far back as medieval times. They are forms of military tradition which add color and heritage to the profession of arms. Today, we're about to witness such a custom by the traditional passing of the organizational colors. Although commanders and troops come and go, the colors of the organization remain as a perpetual symbol of its glorious past and a reminder to present-day members of their responsibility to uphold that tradition. It is the colors that bear the history of the unit, its battles, and its campaigns.
Forward, march.
Colonel Mower is now receiving the colors from Sergeant Major Quinn, symbolizing the trust and confidence placed in the non-commissioned officers of the Health Center. Brigadier General Harder receives the colors from Colonel Mower, symbolizing the successful completion of his command and the relinquishment of his authority. The passing of the colors from the reviewing officer, Brigadier General Harder, to the incoming commander, Colonel Cramer, signifies the passing of her trust and also the responsibility for the unit and its soldiers. Passing of the colors from the incoming commander, Colonel Cramer, to Sergeant Major Quinn signifies the confidence that the commander places in the non-commissioned officer corps and is the Sergeant Major's first act of allegiance to her new commander. By authority of paragraph 2-5A, Army Regulation 600-20, the undersigned assumes command of Munson Army Health Center, Fort Leavenworth, Kansas. Signed, Garrick L. Cramer, Colonel, Medical Service Corps, Commanding. Ladies and gentlemen, Deputy Commander of Regional Health Command Central, Brigadier General Wendy L. Harder.
All right, round of applause for that.
So good morning, distinguished guests, family, staff, and friends who are watching from Facebook. I'm glad to be here with the talented Munson Army Health Center staff, the Combined Arms Center, and the Fort Leavenworth community. You will note the ceremony today reflects the changes we have made to preserve the health and safety of all who are involved. However, the importance of this time-honored ceremony has not changed. Honoring these two leaders, the commander who served with honor, and the officer who is assuming the mantle of command, is still a necessary part of our Army culture, especially during these extraordinary times. I want to thank those whose hard work, diligence, and safe, conscientious execution of today's ceremony keep our patients, families, staff, and soldiers safe. I would like to personally welcome our honorees and their families. Colonel Scott Mower and his wife Tara and their adult children watching from Facebook, Specialist Kevin, Angie, and Nixon Mower, ROTC cadet Savannah Mower and Cole Mower, a senior at the University of Maryland, Hagerstown, and to Colonel Garrick, Cramer, and his wife Michaela, and their daughters Angelica and Bailey, who wasn't able to join us today. Welcome to the RHCC family. I would also like to welcome the families of our honorees today who are also watching via Facebook. Colonel Mower's mother, Bonnie Mower, his uncle, Louis Blenard, and aunts Leanne, Donna Sue, and Paula Blenard. Colonel Cramer's parents, Mr. and Mrs. Carl and Nettie Cramer, his siblings, Carl and Natasha, and Mrs. Cramer's parents, Mr. and Mrs. Giovanni, and Marissa Fontana, all the way from Italy. I want to recognize the more than 359 soldiers, civilians, and contractors here at Munson who work tirelessly with such compassion and commitment to provide world-class health care here at Fort Leavenworth. Thank you for all you do to make a difference to our soldiers, families, and patients who rely on Munson for their medical needs. If you know Colonel Mower, you know he's not the kind of leader who will wait for things to happen. Through his vision, leadership, and drive, he focuses on positive change. This kind of initiative and forward thinking, paired with a world-class healthcare team, ensured the success of Team Munson. Colonel Mower and the Munson team worked hard to prepare for and pass some of the most rigorous accreditations, certifications, and inspections to include the Joint Commission Gold Seal of Approval, the College of American Pathologists inspection, passed with distinction, and at the U.S. Disciplinary Barracks and the Joint Regional Corrections Facility, their health clinics passed the American Corrections Association inspection with a 100% completion rating and full accreditation. Colonel Mower reached out to the team at Irwin Army Community Hospital at Fort Riley, Kansas, to develop a partnership that benefited both organizations. IAC supported more than 300 audiology encounters that reduced the necessity of transferring inmate patients. In return, the Munson team supported IAC by facilitating more than 1,700 radiology evaluations. Colonel Mower embraced and implemented virtual health care, and through telephonic periodic health assessments and virtual nutrition and specialty appointments, he increased the usage of virtual health care by 446%. In addition, Munson led the entire Army Medical Command in overall patient satisfaction, peaking at 99.3%. Under Colonel Mower's leadership, the Munson team supported the U.S. Southern Command and U.S. Army Africa by sending medical personnel to 5 global health engagements in both Honduras and Ghana. He authored multiple memoranda of agreement with local and government healthcare organizations to provide both simulation and hands-on training to Munson staff, improving medical readiness. And there is so much more. Scott, you and your staff have done an amazing job raising the bar on military medicine and working toward changes that make real, concrete improvements for your staff and your patients. Your relentless drive for a medically ready force and a ready medical force leave a remarkable legacy here on Fort Leavenworth. However, I would be remiss if I did not mention the love and support you received from your family. So to your wife, Tara, and the entire Mower family, thank you for the support and understanding you have given Scott, this command, this post in the Army. Scott, I can think of no better place for you to have the biggest impact on the lives of our soldiers than as the Force Health Protection Officer at Regional Health Command Europe. Best of luck, and thank you. Colonel Cramer and Michaela, welcome to our great region. I know you possess the knowledge, leadership, and strategic organizational skills necessary to ensure this command continues to maintain its status as a premier medical platform for the world's best expeditionary and globally integrated fighting force. Know the Regional Health Command Central family is also here to support you in all you do. As we move into the future, the one constant is that we support and care for the less than 1% of our nation's people who have signed on the dotted line and written a check to the American people in the amount of everything. These men and women who are willing to give their lives to protect our country deserve no less than the very best. I can think of no greater honor than to serve those who serve our nation. So thank you for all for watching today's ceremony. You honor these great leaders and our amazing Munson medical team by your presence. Army medicine is Army strong.
Ladies and gentlemen, the outgoing commander of Munson Army Health Center, Colonel Scott A. Mower.
Good morning, Brigadier General Harder, Chaplain McDonald, distinguished guests, esteemed colleagues, and mighty Munson teammates. Thanks for participating virtually in today's change of command ceremony and affording me this opportunity to give a farewell to the wonderful people comprising this fantastic command at Munson Army Health Center. Before the COVID-19 pandemic started and we had to discontinue large gatherings, I would open up the Munson Tuesday and Thursday safety huddles by covering the National Day calendar events. In my opinion, this proved to be a good icebreaker and a way to lighten the mood before we got down to serious business. One of the more memorable occasions was the huddle coinciding with last year's Speak Like a Pirate Day, especially when it came time for pharmacy to cover their safety topics. For old time's sake, I would ask for your indulgence one more time as I cover the national calendar events for the 24th of June. Today happens to be both International Fairy Day and World UFO Day. For those interested in celebrating National Fairy Day, I suggest sitting down with your kids to watch an episode of the Nickelodeon cartoon Fairly Odd Parents. For those interested in celebrating UFOs, a pilgrimage to Area 59 may be in order. It was 24 months ago when I first took command of Munson Army Health Center. At that time, the major event coming down the pike was a fall time frame Joint Commission survey. Little did I or anyone else know that we would face additional challenges as or even more difficult than this dreaded survey. I would be hard-pressed to list all the challenges faced, but a few readily come to mind. Arguably the most recent and hands-down difficult challenge has been responding to the COVID-19 pandemic, where we had to rapidly stand up a curbside pharmacy, pivot from face-to-face to virtual medicine, define the definition of mission essential employees, implement a host of new infection control measures at every level throughout the facility, and integrate our ops cell into the Garrison Emergency Operations Center. Regardless of the challenge, there was not one instance when we did not roll up our sleeves and work as a team to get the mission done on time and to standard. If I was asked what I will most miss about Munson, my answer would be having the opportunity to continue working alongside my amazing civilian, contractor, and military personnel teammates, and making a positive difference for our beneficiaries, the community, the Army, and this great, wonderful nation we call home. Over the past 2 years, I fervently believe we have made a positive difference by working together. We have improved the delivery of patient-centered health care to inmate populations. We have instituted procedural changes to drastically reduce pharmacy wait times, established a workplace violence prevention program serving as a model for adoption across the installation, instituted public health measures to reduce on-post housing-related health concerns, medically in and out processed several thousand CGSC and 15th MP Brigade soldiers, administered thousands of vaccinations, boosted patient access across our clinical service lines, and even added a few additional procedures such as Botox migraine treatments to expand the clinical practices of our providers and meet the needs of those patients that we serve. We, by working as a team, have most definitely accomplished a lot of things to be proud of. In recognition of the importance of teamwork, I want to spend the bulk of my remaining remarks thanking teammates. I wish to apologize up front that I cannot possibly thank all those that deserve this recognition. I'll start out by thanking my senior leaders, Lieutenant General Rainey, the Fort Leavenworth Senior Mission Commander, and Brigadier General Appenzeller, the Regional Health Command Central Commander. The patient guidance, mentorship, and command attention received from these two outstanding leaders helped us to keep the doors open and advance the delivery of top-notch healthcare services. I also wish to thank Brigadier General Harder for her kind words and wish her success as she assumes command of Regional Health Command Central in the early part of July. Second, I wish to thank Colonel Hung and Command Sergeant Major Jones, the Fort Leavenworth Garrison Command Team, for their fabulous support. A few examples of their fabulous support include removing the snow in our parking lots and making sure we had child care service access for our essential employees during the COVID pandemic. Third, I'd like to thank Colonel Kerry Smith, the 15th MP Brigade Commander, and Major Kelly Davidson, the 15th MP Brigade Surgeon. Their collective commitment to excellence in building partnerships helped us to make sure significant healthcare delivery improvements at the Military Corrections Complex occurred. Next, I'd like to thank my wonderful deputies, Lieutenant Colonel Boyd, Major Henjum, Ms. Tracy Wooten, and Lieutenant Colonel Huntermark for their stellar advice and counsel. They kept me well informed, pushed forward my initiatives, and fearlessly spoke truth to power on those all too frequent occasions when I came up with a harebrained idea. Fifth, I'd like to thank the command group secretaries, Ms. Karen Cole and Ms. Rosie Gates. Their extraordinary efforts in managing schedules, answering phone calls, preparing correspondence, and doing hundreds of other tasks that I'm probably not even fully aware of, gave me and the rest of the command group the time we needed to focus on other important matters. I also want to recognize my public affairs officer, Ms. Tracy McClung, for being such an outstanding public affairs officer and for videotaping today's Facebook Live ceremony. Sixth, I want to thank my battle buddy, Sergeant Major Quinn, for sharing her wisdom and offering me encouragement. She helped me to skillfully navigate through many tricky situations and was a never-ending fountain of down-to-earth wisdom. Next, I want to thank all of you, my Munson teammates. President Reagan once said, "Surround yourself with great people, delegate authority, and then get out of the way." I was blessed by having great people like you surrounding me. I found President Reagan's advice extremely useful to follow as the commander here. As long as I gave you all a little guidance, made sure you had the necessary resources, and then just got out of your way, the MAC workforce always made great things happen. Last but not certainly least, I must thank my wife, Tara. Through 26 years of marriage and my entire military career, she has stood beside me through thick and thin. I have treasured every day spent with her and look forward to embarking on the next chapter of our life together in Germany. Garrick, welcome to the mighty Munson family. I have no doubt you would do a spectacular job as the next commander. You're taking over one of the best medical organizations made up of the finest professionals in all of military medicine. Based on your past leadership successes and your vast experience, you're definitely ready to lead them down the path that lies ahead. In closing, serving as the MAC commander has been the pinnacle assignment of my military career. It has been a high honor leading each and every one of you. I will always treasure the memories and friendships made here at Fort Leavenworth, and may you have blessed days ahead, and may the Kansas City Chiefs win another Super Bowl. Colonel Mower signing off.
Ladies and gentlemen, the commander of Munson Army Health Center, Colonel Garrick Cramer.
So thank you and good afternoon. Good morning and good afternoon, Brigadier General Harder, Command Sergeant Major Camacho, Command Sergeant Major Sellers, Command Sergeant Major Garcia, fellow commanders, fellow sergeant majors, and all distinguished and honored guests. Scott, Tara, thank you for the warm welcome and hospitality when we arrived and during this transition. You have led this organization superbly, and I thank you for that. Some very dear friends and families are virtually with us today across the globe. I want to thank you all for attending. Without your love, teaching, mentorship, guidance, and support over the many years and decades, this would have never been possible. Mostly, I want to say thank you to the soldiers and civilians of the Munson Army Health Center. Thank you for being able to be so flexible over the last few months, as this pandemic has definitely changed the way we conduct and provide care. Before I begin my remarks, there are some other folks I want to thank too. So 29 years ago, I raised my right hand to support and defend the Constitution and have been proudly doing that ever since. But there's a small group with me here today who serve our nation, and they weren't there to raise their right hand or volunteer. They just kind of got born into it or married into it. That's my wife, Michaela, and my children, Angelica and Bailey. 3 moves in 4 years, 3 different high schools in 4 years, and not a word of complaint out of any of them. I could not do what I do without your guys' love and support. Thank you. We're no different than any other Army family. It's our families that have served every bit as much as we do, and we just can't get it done without any of you. I'm not sure words can sufficiently capture the feelings I'm having right now. Excited, proud, humbled. These are all true, but seemingly inadequate, particularly considering as you reflect on the story and history of this health center. Since the inception of Fort Leavenworth in 1827, there have been 5 hospitals located on this post, with the health care of the command being paramount. Each hospital has functioned to provide health services to the command, the dependents, and the retired community. The amazing soldiers and civilians of Munson Army Health Center continue to provide the best, constant, dedicated health care to our beneficiaries and the command, like they have done in the past and like the 4 hospitals before us have done over the last 193 years. I am excited, I am proud, and I am humbled to join this great team. Army medicine is Army strong, constant, dedicated care.
Ladies and gentlemen, please rise for the playing and singing of the Army Song.
March along, sing a song with the army of the free. Count the brave, count the true, who have fought to victory. We're the army and proud of our name. We're the army and proudly proclaim. First to fight for the right and to build the nation's might, and the army goes rolling along. Proud of all we have done, fighting till the battle's won, and the army goes rolling along. And it's high, high day, the army's on its way. Gallant games loud and strong. Oh, wherever we go, you will always know, and the army goes rolling along.
Ma'am, this concludes the ceremony.
Great job. Take charge of command.
Ladies and gentlemen, this concludes today's ceremony. Thank you for attending or watching virtually the ceremony.